How long after environmental management has cleaned a patient's room do the common touch surfaces remain safe for caregivers to work with touch and for patients to touch? That's a difficult question to answer without a microbiologist on staff to do the swabbing and the testing and the plating and the reporting back. And unfortunately that takes hours, if not days, to get that kind of reporting. What we like to advocate is a tool that we think every infection preventionist should have in her toolbox. And that's an ATP meter, a luminometer and ATP swabs. We like this tool because it gives you immediate feedback on contamination of a surface. It measures organic contamination. And what we're going to do is demonstrate that today. Anna Marie is going to use this swab. She's going to swab this surface, which is visibly clean. She's going to use a standard swabbing technique over a defined area. She's going to plunge the swab into the activating agent. She's going to give it a shake or two, and she's going to insert it into the luminometer. Now what ATP does is it measures the amount of organic contamination on a surface. Now, organic contamination doesn't always mean that there are pathogens or microbes present, but we know that if the score is high, the probability is very high that there are microbes present. We also know if the score is very low or 0, the probability is very low that there are microbes present. In this situation, the score is 2,566, well above a standard which we would say should be about 200 or less for this type of surface. So now what are we going to do? What we're going to do is demonstrate what we call real-time cleaning, an activity that we believe professional staff, caregivers, should take to keep surfaces safe to touch. I've just wiped this surface that we've just tested with a disposable wipe, a disinfectant wipe that will take a little time to dry, but once it's dried, we are going to test it again with ATP to show you the effect of how simple it is to keep your surfaces clean and touch ready. So if Anna Marie would test that surface again. Again, swab technique over a small part of the surface. Insert, activate, shake, and measure. What we're measuring is organic contamination. It's a proxy for pathogen presence or microbe presence. The higher the score, the higher the risk. The lower the score, the lower the risk. This score was 2,500 and something before. It's now 88, a significant reduction in surface contamination, a significant reduction in the risk for cross-contamination. This is a touch-ready surface. This is a surface caregivers can use with confidence, knowing that their hands aren't becoming contaminated by the pathogens that might be on it.